If you are approaching Medicare eligibility, or if you are already enrolled and wondering whether you made the right choice, there is one decision that matters more than almost any other: Medicare Advantage or Medigap. These two options represent fundamentally different philosophies about how you manage your health care in retirement, and choosing the wrong one for your specific situation can cost you tens of thousands of dollars. I want to be clear about something before we begin. This channel has no affiliation with any insurance company. I am not going to tell you which option is better because the honest answer is it depends entirely on your health, your finances, and your priorities. What I am going to do is give you every piece of information you need to make this decision yourself, with confidence. By the end of this video, you will understand exactly how each option works, what it costs, who it's right for, and the questions you must ask before signing up for either one. Let's get started. To understand why Medicare Advantage and Medigap exist, we first need to revisit Original Medicare and its most significant weakness. Original Medicare, Parts A and B, is powerful, but it has two major financial vulnerabilities. Vulnerability number one: the 20% coinsurance in Part B has no out-of-pocket maximum. If you have a $500,000 medical event, your 20% share is $100,000. Medicare will not cap that. Vulnerability number two: Original Medicare does not cover prescription drugs, dental care, vision, or hearing, four of the most common and expensive needs for people over 65. These two vulnerabilities created a market, and that market produced two very different solutions: Medigap, which patches the holes in Original Medicare, and Medicare Advantage, which replaces Original Medicare entirely with a private alternative. That distinction, patching versus replacing, is the most important thing you can understand going into this decision. Medigap, also called Medicare Supplement Insurance, is a private insurance policy that works alongside Original Medicare to cover costs that Medicare leaves behind. Think of it as a second layer of coverage on top of your existing Parts A and B. Depending on the plan letter you choose, Medigap can cover your Part A and Part B deductibles, your Part B 20% coinsurance with no cap, your hospital coinsurance for extended stays, skilled nursing facility coinsurance, and in some plans, emergency care during foreign travel. Medigap plans are standardized and identified by letters A, B, C, D, F, G, K, L, M, and N. Standardized means that a Plan G from Blue Cross is legally required to offer the exact same benefits as a Plan G from Aetna. The only difference between insurers for the same letter is the price they charge. The two most popular plans for new enrollees in 2026 are Plan G and Plan N. Here is why. Plan G is the most comprehensive plan available to new Medicare enrollees. It covers virtually everything Original Medicare does not, including the Part B 20% coinsurance with no cap, the Part A deductible, and skilled nursing coinsurance. The only cost you pay out of pocket is the Part B annual deductible, which is $257 in 2026. After that, your medical costs are essentially zero for the rest of the year. Plan N is a lower premium alternative to Plan G. It covers the same major benefits, but you pay co-payments of up to $20 for doctor visits and up to $50 for emergency room visits. If you are generally healthy and rarely see specialists, Plan N can save you significant money on premiums while still protecting you from catastrophic costs. Plan F was the most popular Medigap plan for decades because it covered everything, including the Part B deductible. However, Plan F is no longer available to people who became eligible for Medicare on or after January 1st, 2020. If you already have Plan F, you can keep it, but new enrollees cannot purchase it. Medigap does not cover prescription drugs. You will need a separate Part D plan for that. It also does not cover dental, vision, hearing aids, or long-term care. And it does not cover care outside the United States, with the exception of certain plans that offer limited foreign travel emergency coverage. Medigap premiums vary significantly by your age, your location, the insurer you choose, and the plan letter you select. As a general benchmark, in 2026, Plan G premiums typically range from $100 to $300 per month for a 65-year-old, depending on the state. Plan N premiums are typically 20 to 30% lower than Plan G for the same insurer. Here is something critically important. If you miss your Medigap open enrollment period, which is the 6-month window that begins the month you turn 65 and enroll in Part B, insurers can use medical underwriting to deny your application or charge you higher premiums based on your health history. Outside of that window, your health status can price you out of Medigap permanently. The Medigap open enrollment period is a one-time window in most states. After it closes, insurers can legally deny your application based on pre-existing conditions. Do not miss it. Medicare Advantage, officially called Medicare Part C, takes a completely different approach. Instead of supplementing original Medicare, it replaces it. When you enroll in a Medicare Advantage plan, a private insurance company takes over the delivery of your Part A and Part B benefits and typically adds more on top. Most Medicare Advantage plans bundle prescription drug coverage, effectively replacing Part D. Many include dental, vision, and hearing benefits. Some offer gym memberships, meal delivery after hospitalization, transportation to medical appointments, and over-the-counter allowances for health products. These extras are real, and for healthy, younger retirees, they represent genuine value. But here is the trade-off that every Medicare Advantage enrollee must understand. Medicare Advantage plans operate within networks. Most plans are either HMOs, health maintenance organizations, or PPOs, preferred provider organizations. With an HMO, you typically must use doctors and hospitals within the plan's network, and you often need a referral to see a specialist. With a PPO, you have more flexibility, but out-of-network care costs significantly more. This means your current doctor may not be in-network. Your preferred hospital may not be covered. And if you travel, or if you spend part of the year in another state, accessing in-network care can become a serious challenge. Original Medicare and Medigap, by contrast, are accepted by any provider in the country that accepts Medicare. Medicare Advantage plans also require prior authorization for many procedures and services. This means the insurance company must approve your treatment before it is delivered. A 2022 report from the Office of Inspector General found that Medicare Advantage plans denied 13% of prior authorization requests that would have been covered under original Medicare. While many denials are eventually overturned on appeal, the process creates delays, and delays in medical care have consequences. Many Medicare Advantage plans advertise a $0 monthly premium, and that is accurate. You still pay your Part B premium of $185 per month, but you pay no additional premium to the Advantage plan itself. However, you will pay co-payments and coinsurance each time you use services. A specialist visit might cost $40 to $50. An inpatient hospital stay might cost $300 to $400 per day. The key protection is the out-of-pocket maximum. In 2026, no Medicare Advantage plan can have an in-network out-of-pocket maximum above $9,350 per year. Once you hit that limit, the plan covers 100% of in-network costs for the rest of the year. That $9,350 cap applies to in-network care only. Some plans have a separate higher out-of-pocket maximum for out-of-network care. Always check both figures before enrolling. Now, let's put these two options side by side across the criteria that matter most. I'll go through 10 of them. Number 1, monthly cost. Medicare Advantage, typically $0 to $50 per month in addition to your Part B premium. Medigap Plan G, $100 to $300 per month in addition to your Part B premium. Advantage wins on monthly premium. Number 2, provider freedom. Medicare Advantage, restricted to network, referrals often required. Medigap, any provider in the U.S. that accepts Medicare, no referrals needed. Medigap wins on flexibility. Number 3, catastrophic cost protection. Medicare Advantage, out-of-pocket maximum of up to $9,350 per year in-network. Medigap Plan G, after the $257 Part B deductible, your out-of-pocket costs are essentially zero. Medigap wins for catastrophic protection. Number 4, prescription drug coverage. Medicare Advantage, most plans include drug coverage. Medigap, you must purchase a separate Part D plan. Advantage wins on convenience. Number 5, dental, vision, and hearing. Medicare Advantage, most plans offer some coverage for these. Medigap, not covered. Advantage wins on extra benefits. Number 6, travel and out-of-state care. Medicare Advantage, typically limited to your plan's service area. Medigap, accepted nationwide by any Medicare provider. Medigap wins for travelers and snowbirds. Number 7, prior authorization. Medicare Advantage, required for many services. Medigap with Original Medicare, no prior authorization for Medicare-covered services. Medigap wins on care access. Number 8, enrollment flexibility. Medicare Advantage, you can switch plans every year during open enrollment in October and November. Medigap, switching plans outside your initial enrollment window may require medical underwriting. Advantage wins on flexibility to change. Number 9, predictability of costs. Medicare Advantage, costs vary each time you use services, making annual costs harder to predict. Medigap Plan G, after your deductible, costs are essentially fixed. Medigap wins on financial predictability. Number 10, best for complex medical needs. Medicare Advantage, networks, and prior authorization can create barriers for people with serious conditions. Medigap, broader access and fewer restrictions. Medigap wins for people managing chronic conditions or expecting significant medical needs. Medicare Advantage tends to win for healthy people who want low monthly costs and extra benefits. Medigap tends to win for people who want maximum freedom, predictability, and protection against serious illness. Let me now give you a framework for making this decision based on your actual situation. Medicare Advantage may be the right choice if you are relatively healthy and do not expect significant medical expenses in the near term. If your current doctors and preferred hospital are in the plan's network and you verify this before enrolling. If the $0 or low monthly premium is a genuine financial necessity. If you value the added dental, vision, and hearing benefits. And if you are comfortable doing the work each year during open enrollment to confirm your plan still fits your needs. Medigap may be the right choice if you have one or more chronic conditions and expect to use the healthcare system frequently. If you have established relationships with specialists you do not want to lose. If you travel regularly or split your time between states. If you prioritize financial predictability and want to know exactly what your healthcare will cost each month. Or if you simply want the peace of mind of knowing that a catastrophic diagnosis will not also become a financial catastrophe. In my research, there is one profile that consistently gets hurt by the wrong choice. It is the person who enrolls in Medicare Advantage because of the low premium, misses their Medigap open enrollment window, develops a serious illness a few years later, and then cannot switch to Medigap because they are denied due to their health history. At that point, they are trapped. They cannot afford the network restrictions and prior authorization denials that come with their Advantage plan, but they cannot get into Medigap either. This is a real situation that affects real people every year. The way to protect yourself is to make the right decision at the beginning, during your initial enrollment window, when you have guaranteed access to Medigap regardless of your health. Do not enroll in Medicare Advantage during your initial enrollment period with the intention of switching to Medigap later. In most states, that switch requires medical underwriting, and a diagnosis in the interim can close the door permanently. Before you sign up for either option, ask yourself these 5 questions. Question 1. Are my current doctors and preferred hospital in network for the Advantage plan I'm considering? Do not assume. Call the doctor's office directly and confirm. Question 2. Am I still within my Medigap open enrollment period? If yes, you have guaranteed access to Medigap regardless of your health. If no, you need to apply and potentially go through underwriting. Do that before ruling Medigap out. Question 3. What are my actual expected healthcare costs this year, including all my prescription medications? Use the Medicare Plan Finder at medicare.gov to model your total costs under each option. Question 4. Do I travel, live in multiple states, or expect to receive care outside my home area? If yes, network restrictions in Medicare Advantage may be a serious problem. Question 5. What is my risk tolerance? If the idea of an unexpected $9,000 medical bill, even once, would significantly impact your retirement finances, Medigap's predictability may be worth the higher monthly premium. Let's close with the summary. Medicare Advantage offers lower monthly premiums, bundled drug and extra benefits, and an annual out-of-pocket cap. It works best for healthy people who are comfortable with network restrictions and annual plan reviews. Medigap gives you maximum provider freedom, predictable costs, 0 barriers to care for covered services, and protection against catastrophic medical bills. It works best for people who prioritize access, predictability, and peace of mind, and are willing to pay a higher monthly premium for those guarantees. And the single most important piece of advice I can give you: make this decision during your initial enrollment window, when your access to Medigap is guaranteed by law. Because if you wait and your health changes, that door may close permanently. If this video helped you understand your options more clearly, subscribe to this channel. In our next video, we will walk through the Medicare open enrollment period for 2026, what changes you can make, and how to compare your options using the official Medicare Plan Finder tool, step by step. Drop your question in the comments below. What is the biggest thing stopping you from making this decision right now? I read every comment, and your question may shape our next video. Thank you for watching Medicare Made Simple. This decision matters, and you are making it the right way.